Assalamu alaikum. Welcome to our channel, our vet school. In this video I'm going to discuss about antibiotics. First question, what is antibiotics? Antibiotics are the agents or drugs which produced by various type of organism and inhibit or prevent the growth, multiplication of other organism, such as penicillin, cephalosporin, sulphonamide, tetracycline, aminoglycosides, macrolides, quinoline groups, and miscellaneous antibiotics such as bacitracin, rifampicin, and chloramphenicol. Now we discuss some of these classes. Here is a mnemonic way to remember these classes. The mnemonic is, antibiotics can, protects the, queen, men, servants, and guards. Take the first letter of each one, and it's the first letter of antibiotics class. First letter of the mnemonic beginning is A, which means aminoglycosides. C means cephalosporin. P means penicillin. T means tetracycline. Q means quinolones or fluoroquinolones. M means macrolides. S means sulphonamide. G means glycopeptides. First, aminoglycosides, source Streptomyces species. Indication, mainly used against gram-negative organism, and also gram-positive organism. For example, tuberculosis, brucellosis, mastitis, septicemia, E. coli infection, salmonellosis, pseudomonas, otitis and any type of gastrointestinal tract infection. Generic name of aminoglycosides: streptomycin, dihydrostreptomycin, neomycin, gentamicin, kanamycin, amikacin, tobramycin. Mode of action, it's a bactericide or antibiotics, inhibit protein synthesis by binding 30S ribosomal subunit of microorganisms. Side effects of aminoglycosides: nephrotoxicity, ototoxicity, neurotoxicity, myotoxicity, hypersensitivity reaction, skin rash, eosinophilia, dermatitis. Secondly, cephalosporin. Source Cephalosporin acremonium. Indication, acts against gram-positive and gram-negative bacteria. For example, otitis, tonsillitis, upper respiratory infection, pneumonia, bronchitis, aspiration pneumonia. Note, if penicillin resistance, gonorrhea, syphilis. Contraindication, hypersensitive animal, renal failure, pregnant animal. Generic name, cefamandel, sphonacid, sfoxetin, cefoxime, cefminoxime. Mode of action, bactericidal, inhibits cell wall synthesis. Side effect, neurotoxicity, nephrotoxicity, GI upset, thrombocytopenia, agranulocytosis. Thirdly, penicillin. Source Penicillin notatum, Penicillin chrysogenum. Indication, acts against mainly gram-positive bacteria. Broad spectrum of penicillin is also available. For example, anthrax, black quarter, tetanus, listeriosis, leptospirosis, syphilis, gonorrhea, actinomycosis, actinobacillosis. Contraindication, hypersensitive animal. Generic name of narrow-spectrum penicillin, penicillin, G, penicillin, B, cloxacillin, dicloxacillin, flucloxacillin. Generic name of broad-spectrum penicillin, ampicillin, amoxicillin. Mode of action, bactericidal, inhibits cell wall synthesis. Side effect, hypersensitivity reaction, anaphylactic shock, skin rash, swelling of joints, severe pain, neurotoxicity, nephrotoxicity, GI upset, loose motion, nausea, vomition. Fourthly, tetracycline. Source of tetracycline, Streptomyces species. Indication, acts against gram-positive and gram-negative bacteria, rickettsia, chlamydia, mycoplasma. For example, pneumonia, cholera, peptic ulcer, UTI, malaria, amoebiasis, gonorrhea, syphilis. Contraindication, any older-aged patient, hypersensitive animal, renal failure, pregnant animal, cause teratogenic effect, not abortion. Generic name, dinclocycline, doxycycline, minocycline, oxytetracycline, tetracycline. Mode of action, bacteriostatic. Inhibit protein synthesis by binding with 30S ribosomal subunit of microorganisms. Side effect, hypersensitive reaction, skin rash, urticaria, dermatitis, GI upset, nausea, vomition, diarrhea, colic, bone deformities, nephrotoxicity, renal damage. Fifthly, quinolones. Source of quinolones. Synthetic source. Indication. Effective against gram-positive and gram-negative bacteria. For example, bronchitis, pharyngitis, pneumonia, UTI, typhoid, TB. Contraindication: pregnancy, renal failure animal, liver cirrhosis, hypersensitivity reaction, GIT infection, anorexia, vomition, diarrhea. Generic name of quinolones: ciprofloxacin, levofloxacin, enrofloxacin, loamfloxacin, gatifloxacin, nalidixic acid. Mode of action: bactericidal, inhibit DNA replication. Side effect: abortion, teratogenicity, hypersensitivity reaction, GIT infection, anorexia, vomition, diarrhea. Sixthly, macrolides. Source of macrolides: Streptomyces species. Indication: it is the safe drug in pregnancy period. It used against gram-positive organism. For example, tonsillitis, dysentery, mycoplasmosis, aspergillosis or Brutta pneumonia, and diphtheria. Contraindication: hypersensitive animal. Generic name: erythromycin, azithromycin, fluorithromycin, roxithromycin, fluorithromycin. Mode of action: bacteriostatic. Inhibit protein synthesis by binding with 50S ribosomal subunit of microorganisms. Side effect: toxicity and hypersensitivity reaction, eosinophilia, skin rash, GIT infection, liver hepatitis, jaundice. Seventhly, sulphonamide. Source of sulphonamide: synthetic, sulphonamide, and its derivatives. Indication: acts against mainly gram-positive bacteria, and some gram-negative bacteria. It also acts against rickettsia, and chlamydia. For example, typhoid, paratyphoid, influenza, upper respiratory tract infection, pharyngitis, malaria, bacillary dysentery, conjunctivitis, dysentery, gonorrhea, UTI, burn, used topically. Contraindication: pregnant animal, very younger and older animal, renal failure, hepatic insufficiency. Generic name: sulfamethizole, sulfamethoxazole, sulfisocizole, trimethoprim sulfamethoxazole. Mode of action: bacteriostatic. Inhibit nucleic acid synthesis. Side effect: keratoconjunctivitis, renal damage, crystalluria, aplastic anemia, hemolytic anemia, neutropenia, thrombocytopenia, agranulocytosis, avitaminosis, vomition, nausea. That's all today. Please subscribe our channel for next video, and comments below. Thanks for watching.